You've been told you have a slip disc and suddenly your mind races. Will I need surgery? Can it paralyze me? Can I bend again? What even is a slip disc? Don't worry, you're not alone. It's one of the most misunderstood terms in spine health and also one of the most overused. People use it to describe everything from minor backaches to serious nerve compression. But here's the truth. Not every disc issue is dangerous and not every disc issue needs surgery. I'm Dr. Arvind Kulkarni. I'm a spine surgeon, director of Mumbai Spine Scoliosis and Disc Replacement Center. And in this video, I'm going to explain in simple terms what a slip disc really means, how it causes pain, when you should worry, and what treatments actually work versus what don't. So let's get started. So what is a slip disc really? Let's begin by clearing the biggest myth. Discs don't actually slip. Your spine is made up of bones called vertebrae, and between each of these bones is a spinal disc. The disc acts like a cushion, allowing flexibility and absorbing shock. It has an outer layer called the annulus fibrosus, which you can call the capsule, and an inner jelly which is called nucleus pulposus. It is soft. Now when people say slip disc, they are actually referring to a condition where this inner jelly starts to push out through this weakness or tear in the outer ring, that is the capsule, that is the annulus fibrosus. But here's the key. There are different stages of this process and they are all not the same. What is disc bulge versus disc herniation versus extrusion? Again, let's break it down. In disc bulge, the outer ring stretches and weakens. The disc flattens out and bulges out, but the jelly is still inside, often painless or causes stiffness. Disc herniation, the jelly starts to push through a crack in the outer ring. This is what most people refer to as slip disc. It may press on the nerves, causing leg pain, tingling, numbness, heaviness. Now, disc extrusion means that the jelly has broken through the outer layer completely and it is lying in the canal. It may even leak into surrounding spaces. This is more serious and may cause sharp pain, weakness, or sciatica. Each stage has different symptoms and different treatment strategies. A disc doesn't slip like a coin, it bulges, it leaks or ruptures, and each one speaks its own language of pain. Now, why does it cause back pain or leg pain? Here's something most people don't realize. The disc itself doesn't have pain sensors. You can have a disc bulge and feel nothing unless it presses on the nerve. When it does, the result depends on where in the spine it is. In the lower back, it can press on the sciatic nerve, causing leg pain, numbness or tingling, altogether which is called sciatica. In the neck, it can affect the nerves going to the shoulders and arms. Sometimes the pain is dull. Sometimes it shoots down one leg. Sometimes it comes with weakness or a sensation of pins and needles. If you had back pain that started moving into your leg or arm, it's worth getting evaluated. That's usually a sign that a disc may be involved. So when should you worry? So here's the reassuring part. Most disc issues get better without surgery. In fact, more than 80 to 90% of patients recover through time, targeted physiotherapy, anti-inflammatory medications, and avoiding movements that aggravate the disc. Your body has an incredible ability to heal. In many cases, the disc dries out over time and shrinks away from the nerve, leading to good relief. But, and this is very important, there are red flags where you should not wait. If the pain is severe and constant, if you're developing numbness or weakness, if there is loss of bladder or bowel control, if you have foot drop or cannot lift your foot while walking, or if symptoms last beyond 6 weeks with no improvement. These are signs that the nerve is under serious pressure and delayed care can lead to long-term damage. Now let's talk about treatment because this is where a lot of misinformation spreads. Physiotherapy, especially core strengthening, nerve glides and posture training help. Short-term medication, this also helps in reducing pain and inflammation. Better sitting habits, hydration, sleep posture are very important. In some situations, epidural injections may be indicated to reduce nerve inflammation. Education is also very important to understand the condition. This helps in reducing fear and speeding up recovery. Now, what are the things that don't work? Pain balms and sprays, unsupervised spinal decompression machines. These are risky without diagnosis. Forceful manipulation or bone setting. Bed rest for a few days is okay, but bed rest for weeks delays healing. Magic pills and miracle cures from unverified sources, these are basically to make money. You can't push a disc back with an oil or a belt. You can only guide the body to heal with the right tools and timing and counseling. Now, when it comes to surgery, when is it really needed? So let's address the elephant in the room. Do you need surgery for slip disc? In 90% of times, no. But surgery becomes necessary if you have severe or progressive nerve damage. There is loss loss of function like bladder control or foot drop. You tried 6 to 8 weeks of conservative treatment with no relief, or your pain is affecting your ability to live, walk, or work. The good news is modern spine surgeries are minimally invasive, safer, and offer faster recovery than ever before. So if your doctor suggests surgery at some point, it's not something to fear, but something to be understood fully. So finally, if your back is hurting, please don't panic, but don't ignore it either. A slip disc is not the end of your mobility. It's a wake-up call from your spine. Your spine is strong, but it's not silent. When it speaks, listen early, act wisely. With the right care, right counseling, the right guidance, and the right patience, and you get back to living life fully. If this video helped you understand your spine a little better, please take a moment to like, share, and subscribe. It helps spread awareness and might help someone else avoid panic or misinformation. And as always, if you're unsure, consult a trusted spine specialist near you. Every spine is different, but healing is possible. Thank you for watching.